Welcome to Easy English Lab. I'm Emma, and I'm here with my co-host, Jake. Hello to all our listeners around the world.
Hi, everyone. We're so excited to start this new series about health and wellness. Whether you're listening in Brazil, Vietnam, or anywhere else, we're happy you've joined us today.
In this series, we'll help you feel confident talking about health in English. We know medical conversations can be scary in another language, so we'll take it step by step.
Today, we're starting with part 1, describing symptoms and common ailments. We'll practice how to explain what's wrong when you're not feeling well.
So, Jake, I have to ask, you look a bit tired today. Is everything okay?
Actually, I'm not feeling my best. I think I'm coming down with a cold or something.
Oh, no. What symptoms are you experiencing?
Well, it started yesterday with just feeling tired. But this morning, I woke up with a sore throat and runny nose.
That sounds familiar. Any fever or body aches?
I do feel a bit warm and my muscles ache all over. It's not too bad, but definitely uncomfortable.
Let's use this as a learning opportunity for our listeners. How would you describe your symptoms to a doctor?
I'd say I have a sore throat, runny nose, and body aches. I think I have a fever, and I've been feeling very tired.
That's clear and direct. Now, let's talk about some useful vocabulary for common symptoms.
For pain, we usually say ache for continuous pain, like headache, stomachache, or backache.
And for stronger pain, we might say sharp pain or throbbing pain. What about your sore throat? How would you describe it?
I'd say it's a scratchy throat or painful swallowing. It's not severe, but it's definitely there.
Now, let's practice a real conversation. Imagine you're at a pharmacy.
Okay, you be the pharmacist.
Hello, how can I help you today?
Hi, I'm not feeling well. I have a sore throat and runny nose.
Any fever or cough?
Yes, I think I have a slight fever and I've started coughing a little.
It sounds like you might be getting a cold. I recommend this throat spray and some cold medicine.
That was helpful. Now, let's try a doctor's visit.
Good morning. What brings you in today?
I've been sick for 2 days. I have a fever, cough, and body aches.
When did the symptoms start?
They began on Tuesday morning. The fever started last night.
Are you taking any medication?
Just some tea with honey for my throat.
Perfect. You're giving all the important information. What's wrong, when it started, and what you've tried.
What if someone has stomach problems? How would they describe that?
They might say, I have an upset stomach, or I feel nauseous. If it's more serious, they might say, I've been vomiting, or I have diarrhea.
And for headaches, you could say, I have a mild headache, or I have a pounding headache, if it's really bad.
Exactly. Now, let's talk about an important point, describing how long you've had symptoms.
This is crucial. Instead of just saying, I'm sick, we should say, I've been sick since yesterday, or this started 3 days ago.
Yes, and describe if it's getting better or worse. My cough is getting worse, or the fever is going down.
What if you don't understand a medical term?
What should you say?
That's a great question. You can say, could you explain that in simpler terms? Or, I'm not familiar with that word. Doctors are usually happy to explain.
That's good to know. Even native English speakers sometimes need explanations of medical terms.
Absolutely. Now, let's practice some emergency phrases. What if someone needs urgent help?
They should know how to say, I need a doctor, or it's an emergency, or please call an ambulance.
And for pain, the pain is severe, or I can't bear the pain.
Before we finish, let's review the key points from today.
First, learn basic symptom words: headache, fever, cough, sore throat.
Second, practice describing when symptoms started and how severe they are.
Third, don't be afraid to ask for clarification if you don't understand.
And fourth, remember that most healthcare workers are very understanding and will help you communicate.
For our listeners' practice this week, try to describe a time you were sick using the vocabulary we learned today.
In our next episode, we'll talk about visiting the doctor and understanding medical advice.
We hope you feel more confident about describing health symptoms in English after today's episode.
Thank you for listening. If you enjoyed this episode, please share it with friends who are also learning English.
Take care of your health, keep practicing your English, and we'll see you next time.
Jake, I remember you mentioned you had a doctor's appointment this week. How did it go?
Actually, it went really well. I went to see Dr. Roberts about that cold we talked about last time.
That's great. What was the experience like?
Well, let me walk you through it. When I arrived, the receptionist asked for my name and appointment time.
That's usually the first step. What did she say?
She said, "Good morning. May I have your name, please? And do you have an appointment?"
Perfect. And what did you say?
I replied, "Yes, I have a 10 a.m. appointment with Dr. Roberts. My name is Jake Wilson."
Excellent. Then what happened?
She asked me to fill out a medical history form. It had questions about allergies, current medications, and previous illnesses.
Those forms can be confusing. Were you able to understand everything?
Mostly, but there were a few terms I wasn't sure about. So I asked the receptionist, "Could you help me with this question? I'm not sure what it means."
That's the right thing to do. It's always better to ask than to guess. What happened next?
After I finished the form, the nurse called me into the examination room.
What did the nurse say to you?
She said, "The doctor will be with you shortly. Could you please step on the scale? I need to check your weight and height."
That's standard procedure. Then what?
She took my blood pressure and temperature. She said, "Your blood pressure is 120/80, which is normal. Your temperature is 38 degrees. You have a slight fever."
Okay, so then the doctor came in?
Yes, Dr. Roberts came in and said, "Hello, Jake. I understand you're not feeling well. What seems to be the problem?"
That's when you used the vocabulary we practiced last time.
Exactly. I said, "I've had a sore throat, runny nose, and cough for 3 days. I also have a fever and body aches."
Good job. What did the doctor ask next?
He asked, "Have you taken any medication for these symptoms? And are you allergic to any medications?"
Those are important questions. How did you respond?
I said, "I've been taking paracetamol for the fever, and I'm not allergic to any medications that I know of.
Perfect. Then what happened?
The doctor examined me. He said, "Let me check your throat, and please take a deep breath." He used a tongue depressor and a stethoscope.
Those are common medical tools. Was the examination uncomfortable?
Not at all. The doctor was very gentle and explained everything he was doing.
That's good to hear. What was the diagnosis?
He said, "You have a viral infection. It's the flu that's been going around. You should rest, drink plenty of fluids, and continue taking paracetamol for the fever."
Did he prescribe any medication?
No, he said antibiotics don't work for viral infections, but he recommended some over-the-counter medicines for the symptoms.
That makes sense. How did the appointment end?
The doctor said, "If your symptoms get worse or don't improve in a few days, please come back." Then the receptionist gave me a printout with care instructions.
That sounds like a very thorough appointment. Let's use your experience to practice some useful phrases for our listeners.
Good idea. Let's start with common questions doctors ask.
Doctors often ask, "When did your symptoms start?" How severe is the pain on a scale of 1 to 10? Have you had this problem before? What makes it better or worse?
And here are some useful patient responses. The pain started 2 days ago. I'd rate the pain as 6 out of 10. This is the first time I've had this problem. The pain gets worse when I move.
Now let's practice a complete conversation between a doctor and patient.
Okay, you be the doctor, and I'll be the patient.
Good morning. I'm Dr. Smith. What brings you in today?
Hello, doctor. I've been having stomach pain since yesterday.
Can you describe the pain?
It's a cramping pain in my lower abdomen. It comes and goes.
Any other symptoms? Nausea? Fever?
Yes, I feel nauseous, but no fever.
Let me examine your abdomen. Please lie down on the examination table.
That was a good practice. Now let's switch roles.
Okay, I'll be the patient this time.
Hello, I'm Dr. Johnson. How can I help you today?
I've had a persistent headache for 3 days.
Where exactly is the pain located?
It's on both sides of my forehead, and it feels like pressure.
Have you taken anything for it?
I tried ibuprofen, but it only helped for a few hours.
Let me check your blood pressure and look in your eyes.
Great. Now let's talk about some important vocabulary for medical examinations.
Some common terms include stethoscope, for listening to heart and lungs, blood pressure cuff, for measuring blood pressure, thermometer, for taking temperature, tongue depressor, for examining throat.
And some examination phrases include, take a deep breath, open your mouth and say, ah. Does it hurt when I press here? Follow my finger with your eyes.
It's also helpful to know how to ask questions if you don't understand something.
Yes, you can say, could you explain that in simpler terms? I didn't understand that word. Could you repeat that, please? What does that mean?
And remember, it's always okay to bring a list of questions or symptoms with you to the appointment.
That's an excellent tip. Writing things down beforehand can really help.
Before we finish, let's review some key points from today.
First, prepare for your appointment by writing down your symptoms and questions.
Second, Don't be afraid to ask for clarification if you don't understand something.
Third, learn basic medical vocabulary so you can describe your symptoms clearly.
And fourth, remember that doctors are there to help you, not judge you.
For our listeners' practice this week, try role-playing a doctor's visit with a friend using the phrases we learned today.
In our next episode, we'll talk about pharmacy visits and understanding medication instructions.
We hope you feel more confident about visiting the doctor in English after today's conversation.
Thank you for listening. If you have any questions about today's episode, please let us know.
Take care of your health, keep practicing your English, and we'll see you next time. Jake, I heard you visited the pharmacy after your doctor's appointment. How did it go?
It was really interesting. I went to pick up some medications and also ask about over-the-counter options for my cold symptoms.
That's perfect for our topic today. Let's walk through your pharmacy visit step by step.
When I entered, the pharmacist greeted me with, "Hello, how can I help you today?"
That's the standard greeting. What did you say?
I said, "I have a prescription from Dr. Roberts, and I'd also like some advice about cough medicine."
Good approach. Being clear about what you need. What happened next?
The pharmacist asked, "Do you have insurance?" and "Have you been to our pharmacy before?"
Those are common questions. How did you respond?
I said, "Yes, I have insurance, and this is my first time at this pharmacy." Then I gave her my insurance card and prescription.
What did she do with your prescription?
She typed something into the computer and said, "It will take about 15 minutes to prepare your medication. Would you like to wait or come back later?"
That's typical. Did you wait?
Yes, I decided to wait and look at the over-the-counter medications while waiting.
Smart. What did you ask about for your cough?
I asked, "Could you recommend something for a dry cough?" The pharmacist showed me several options and explained the differences.
What kind of explanations did she give?
She said, "This one is a cough suppressant for dry coughs, and this one is an expectorant for coughs with mucus." She also explained the dosage for each.
That's very helpful information. How did you choose?
I told her I have a dry cough, so I'll take the cough suppressant. Then I asked, "How often can I take this?"
Good question. What was the answer?
She said, "You can take it every 6 hours as needed, but don't exceed 4 doses in 24 hours.
Important safety information. Now, what happened with your prescription?
The pharmacist called my name and said, "Your medication is ready. Let me go over the instructions with you."
This is a crucial part. What did she explain?
She said, "Take 1 tablet twice daily with food. Continue until finished, even if you feel better." Avoid alcohol while taking this medication.
Those are all important instructions. Did you understand everything?
Mostly, but I did ask, what does twice daily mean exactly? She explained it means morning and evening.
It's always good to ask if you're unsure. What about side effects?
She warned me this medication may cause drowsiness. Don't drive until you know how it affects you.
That's very important safety information. Now, let's use your experience to practice some common pharmacy scenarios.
Let's start with basic vocabulary. What are some common types of medications?
Here are some important terms: prescription drugs, medications that require a doctor's order, over-the-counter, OTC, medications you can buy without prescription. Generic, the chemical name, usually cheaper. Brand name, the commercial name from a specific company.
And some common medication forms are tablets or pills, capsules, liquid medicine, creams or ointments, inhalers.
Now, let's practice some useful pharmacy conversations.
Jake, first, let's practice picking up a prescription.
Hello, I'm here to pick up a prescription for Emma Johnson.
Let me check. Yes, I have it ready. The total is $15. Would you like a consultation about this medication?
Yes, please. Could you explain how to take it?
Take 1 capsule with breakfast and dinner. Store at room temperature.
Good. Now, let's try asking for over-the-counter advice.
Can you help me? I need something for a headache.
We have several options. Do you prefer tablets or liquid?
Tablets would be better. What do you recommend?
This ibuprofen works well for headaches. Take 1 to 2 tablets every 4 to 6 hours as needed. Now, let's practice a more complex situation, asking about side effects.
I'm concerned about side effects from this medication. What should I watch for?
Some people experience mild stomach upset. Take it with food to prevent this. Stop taking it and call your doctor if you develop a rash.
Thank you. What about interactions with other medications?
Are you taking any other prescription drugs? Excellent practice. Now let's talk about understanding medication labels.
This is so important. What information should people look for on labels?
Key information includes dosage, how much to take, frequency, how often to take it, route, how to take it, oral, topical, etc., warnings, special instructions, expiration date, when it expires.
And some common phrases on labels. Take with food, may cause drowsiness, shake well before use, store in a cool, dry place, keep out of reach of children.
Now, what if someone needs medical supplies rather than medications?
They might ask for, do you have bandages? I need a thermometer. Where are the first aid supplies? Do you sell blood pressure monitors?
Perfect. And what about asking for generic alternatives to save money?
You can ask, do you have a generic version of this medication? Or is there another expensive alternative?
Now let's talk about an important topic, medication allergies.
This is crucial. People should always inform the pharmacist about allergies.
Yes, you can say, I'm allergic to penicillin, or I have allergies to certain antibiotics.
And if you're not sure about ingredients, could you check if this contains allergen?
Before we finish, let's review some key points from today.
First, always read medication labels carefully and ask questions if you don't understand.
Second, don't hesitate to ask for generic alternatives to save money.
Third, inform the pharmacist about
any allergies or other medications you're taking.
Fourth, pay attention to storage instructions and expiration dates.
For our listeners' practice this week, look at the labels of medications in your home and try to read and understand the instructions in English.
In our next and final episode of this series, we'll talk about wellness, preventative care, and maintaining good health habits.
We hope you feel more confident about pharmacy visits after today's conversation.
Remember, pharmacists are medication experts who can provide valuable health advice.
Thank you for listening. If you have questions about today's topic, please let us know.
Take care of your health, keep practicing your English, and we'll see you for our final health episode. Continuing our health series, we're now moving to our final topic, wellness and mental health. I'm Emma, and I'm here with Jake.
That's right, Emma. We've covered physical symptoms, doctor's visits, and pharmacies. Now let's discuss how to talk about mental well-being and self-care in English.
This is such an important topic, Jake. Many people find it challenging to discuss mental health, especially in another language. Jake, after our discussion about pharmacies and medications, I've been thinking about how mental health connects to overall wellness.
Absolutely. Mental health affects everything from how we handle stress to how we take care of our physical health. For example, when I'm stressed, I might say, I'm feeling overwhelmed and it's affecting my sleep.
That's a good example. Let's practice some common phrases for discussing mental well-being.
For stress, people might say, I've been under a lot of pressure at work, or I'm dealing with some anxiety lately.
And for seeking help, I think I should talk to a counselor, or I'm considering therapy to help manage my stress.
Let's practice a conversation between someone and a mental health professional.
Okay, I'll be the therapist.
I've been having trouble sleeping and I feel constantly worried.
How long has this been going on?
About 2 months. It started when my workload increased.
Have you noticed any physical symptoms?
Yes, I get headaches and my appetite has decreased.
Now let's talk about positive mental health practices.
People might discuss their self-care routines. I practice meditation every morning, or I make sure to take breaks during the workday.
And for social support, I try to stay connected with friends, or I joined a support group to share experiences.
What about discussing progress in mental health?
Someone might say, I've been feeling more balanced since I started therapy, or my anxiety has decreased with the new techniques I learned.
Let's also cover vocabulary for different mental states.
Important terms include anxiety,
feeling of worry or fear, depression, persistent sad mood, burnout, extreme exhaustion from stress, mindfulness, focusing on the present moment, resilience, ability to recover from difficulties.
And phrases for offering support. How have you been feeling lately? I'm here to listen if you want to talk. Your mental health is important. It's okay to ask for help.
Now let's discuss when someone needs immediate help.
Emergency phrases include, I need to speak with someone right now. I'm in crisis and need immediate help. This is a mental health emergency.
Before we conclude our health series, let's review what we've covered across all 4 parts.
We started with describing physical symptoms, then moved to doctor's visits, pharmacy conversations, and now mental health.
Remember that true health includes both physical and mental well-being.
We hope this series has given you the confidence to discuss health topics in English, whether you're talking about a common cold or seeking mental health support.
Thank you for joining us through all 4 parts of this health series.
Take care of your complete health, both body and mind.